So something simple and practical without even doing any treatment, taking standing breaks. So set a timer, 45 minutes. And when that first timer goes off, that's for your first alarm. Okay, I got to get up soon. Then set another timer for 15 to 30 minutes. Once that second timer goes off, stand up. Definitely, you're saving your hips already just by doing that. Also, movement is important. Just going for a walk. Those are simple, practical stuff I would say to help the entrepreneur or any individual just working from home.
Hello and welcome to the Art of Kaizen for Entrepreneurs podcast, where we discuss how to grow 1% every day in both business and itself. Today, we have Dr. Leslie Villeur, the owner of Quality Movement PT, a company located in Lynbrook, New York, that is prioritizing movement-based care over just chasing pain. Dr. Leslie and his team are taking a root cause approach, analyzing biomechanics, mobility, and stability patterns to help people move better and not just feel better temporarily. As a professional athlete that feels his hips every day, I'm very excited to talk to Dr. Leslie on how he is helping people move and feel better. Thank you for joining me today.
Thank you, Kyle, for everything. I was looking forward to this podcast, so I'm ready to get started, man.
Yeah, and excited to talk to people like you because there is such, in the Western civilization, we have really moved towards common day medicine and prescriptions. And it seems like we go away from what really helps the body, which is the right movement, the right structure. I mean, look at us today sitting in our chairs. I mean, this is how 90% of people work throughout the day, and it just destroys our body. And your company is counteracting that negative effects that the body is having from common day work by helping through true movement and what the body really needs. Can you give me a little background on kind of where this whole concept came from, what your background is, and how you developed your business?
Yeah. So I've been practicing for 6 years now, and the niche that we're in, we are a performance-based physical therapy practice. So, you have physical therapy practices out there, and there's a general notion of physical therapy that it doesn't work. Because a lot of times when you go to physical therapy, it's like a cookie cutter system. It's not really individualized. Even though we're general physical therapy, they're not promoting like medication and pills or steroid shots. It's still generic, and a lot of people get frustrated with that. So with our company, Quality Movement Restoration, we're located in New York. We focus on essentially not just the active individual, but an individual that has a goal to want to move better, live better, and maybe they do have something actively coming up. Like we see a lot of, you know, runners that want to do the marathon, and maybe CrossFitters or tennis players, right? Pickleball players, but anybody that essentially has a goal that they want to work towards, or they just want to simply move better, we're the right practice for you. So yes, with today, there's a lot of more sedentary, jobs, work lifestyle. And yeah, you may not be in pain, but now when you go walk with your kids and it's like your endurance has decreased because your hips are so tight. So this is where we come in. We can work on mobility for you and obviously like tailor that into a goal. So I worked corporate first year coming out, getting my doctor of physical therapy degree, and definitely the notion with general PT, you're seeing like 2, 3 clients, patients in an hour, and you don't get a chance to really hone in and focus on what that individual wants to do. So this could be frustrating for the physical therapist and as well as the client. So let's say that you came in, Kyle, and you were having like some back, hip discomfort, and you generally needed your physical therapist to work on you, but now your physical therapist doesn't have time because they have to see 2 other people within your hour, right? And then they'll probably toss you down to maybe a physical therapy assistant or maybe a technician, but you really need your doctor physical therapy's time. So with that, I found frustration working in corporate, in that realm. And I started our business 2020 in the pandemic. We're a pandemic business, so I actually got furloughed in 2020, and God just led me to start QMR, Quality Movement Restoration. First started in my car working one-on-one with clients, and I saw the need for it and the passion in myself for it. And I'll talk to you about it a little bit later. More physical therapists wanting to work in this one-on-one model, right? Where we can help the active individual and help that individual just get the results that they seeking. So that's kind of how it came about in regards to like creating our company and what we focus on.
Hey, everybody, I hope you're enjoying the content. Just want to take a quick intermission to address the business owners watching this right now. I have been in the marketing industry for over a decade, and I have found that there is two major things that I am trying to help the world understand. One, there's a common denominator to success. Every successful business has the same foundational structure built out, and we'd love to be able to support understanding what that foundation is. And two, 90% of marketing agencies screw you over for one clear identifier, and that is data. Only 3% of consumers are ready to purchase today. The other 97% are being nurtured by your advertising dollars and advertising spend. We created Kaizen Marketing Agency to give you ownership of not only the customers that you're getting through your front door, but also the ownership of your data and understanding what actually grows your business and giving you the control to be able to grow it. My goal personally is to be one of the best marketers in the world. And the only way to do that is to help as many businesses as I possibly can actually grow their company. Not just sell Facebook ads or Google ads, but put a service together that gives you ownership and growth. So I hope you enjoy this content. If you're loving it, make sure you like, comment, and subscribe. And if you really want to know more about how to grow your company and you want a free audit and game plan, we'll hand you the keys to the kingdom of how to be successful. Click the link below. We'll do a 15-minute audit. First 10 minutes, we'll really break down your business. Last 5 minutes, we'll show you those common denominators that you need to be successful for your company and how to implement it into your business. COVID business, right? It's very difficult starting up it during that time. But as you said, when you have a dream and you have a passion, for all the entrepreneurs and business owners listening right now, you have to go after it full force. If it's a pandemic or if it's the society itself that pushes back, it shouldn't hold you back from executing what you want to do to help this world and make it a little bit better. So, you mentioned that the fact that most physical therapists really just spend a limited amount of time with you or pass you off to, say, a junior, right? In your practice specifically, how are you counteracting that? Are you giving people longer time? Are you giving more allocation to an individual? How does it actually work so that your physical therapists are more ingrained with the client and helping their needs?
Yeah, great question. So yes, we work one-on-one with all our clientele, and with the time frame, we have two initial services. We have what we call a free injury movement screen. It's just 30 minutes one-on-one with your doctor of physical therapy, where essentially we will talk about everything that's bothering you movement wise, any pre-existing injury or pain that you may have. We're not treating in that 30-minute appointment. However, it's so valuable because a lot of times when you go to your doctor, you probably get 2, 3, maybe max 5 minutes with your doctor. And a lot of times it's, take this medication, or just let me pass you to my assistant. So it is one-on-one with your doc, that free injury moving screen, which is 30 minutes. And then with that, not only are we educating you on what's happening, we are going to give you a specific game plan to the next step. So after that step, we now move the client into a 75 to 90-minute initial treatment session. So this is a service that a lot of people love, where it's one-on-one. Now you have your doctor for that amount of time, 75 to 90 minutes, and we expand on that free injury screen. So it's a little bit more testing that we're doing. So for more context, we're a holistic practice, so we zoom out. What that means is, let's say you have lower back, hip discomfort. We're not just gonna go zoom in on your lower back and hips. Let's zoom out. Let's take a look at how you're moving through a gait analysis. Like, let's see how you're squatting, bending down, because getting in and out the toilet and out your car, that's a squat. You can't ignore it, right? So we got to take a look at that stuff. Let's take a look at your lunges. That stimulates going up and down a step. Let's look at your balance, right? So we zoom out, and then we zoom in, obviously, on like your lower back, your hip, and then we'll say, Cobb, yeah, definitely, man. We can see why you're having this lower back, this hip discomfort, because we see there's some compensation happening with your posture, with your gait analysis, and then just break it down further like that. And then now we can see that your hip flexor is now compensating because of this. So we do a deep dive breakdown on that 75 to 90-minute initial treatment session. Once we do that, make sure the client is educated and they confirm that they understand everything. Then we move into treatment. Treatment is very hands-on. So what this looks like, we are working on joint mobility. We call it joint mobilization, where we're working to improve the actual movement of the joint. If you're having some more muscle pain, we'll do some soft tissue work. What that looks like, we don't call it massage, we call it soft tissue manipulation and mobilization, where we are looking for a therapeutic effect. Maybe that's blood flow, maybe that's decreasing fascia tightness. It's a sheet that covers muscle to improve, like, said motion, right? So it's not just like a rub down. And then after we do hands-on work, we'll give you a simple exercise to do that duplicates what we worked on in our session. And then after that, we'll have time to answer all your questions and give you a specific game plan, which we offer plan of care packages, which is packaged up in a couple different amount of sessions depending on the individual. So simply, yes, everything is one-on-one, 30-minute free injury screen, 75 to 90-minute initial treatment session. Once somebody gets a plan of care package, we move them into follow-up 60-minute sessions that's still one-on-one.
Absolutely love that because it takes care. And like you said, I thought I had hip problems for a very long time. Come find out I had ankle problems, right? My ankles were too tense, which was causing a disbalance in the way my legs were moving, which caused a disbalance in the hips. And eventually my hips got the butt end of it. And that's where the pain actually was. But come to find out, it was ankle mobility, right? So, that's a huge thing. And we don't know what we don't know, right? And for business owners, right, when you guys are listening to him break down that process, look at the system. Look at the structure. Hear how he explains that, hey, the goal is to fix X problem, and I'm not going to do it the way that normal society does. Even if you look at, say, roofing companies, we recently had a podcast with the roofing company, and those guys, vastly different industry, but the same concept. When you're there to really help people, you have to look at the 10,000-foot overview. You have to understand what was the root cause of the issue so that you can go and solve the problem. If not, then you're just like every other Western medicine type business, which, hey, I'll give you a pill or I'll give you a shot or anything to fix that small problem. And you'll feel great tomorrow. But in 2, 3 years, you still won't be able to squat, go up the steps, pick your kids up, whatever it might be.
Right.
You mentioned pickleball. You mentioned, picking your kids up. Is a majority of your consumers or your ideal customer, are they older? Are you working with athletes? What does it look like? Who's the perfect person when you walk through their front door where you're like, I love this. I know I'm gonna be able to help this person out.
Great question. Yeah, so and we tell clients all the time, age is nothing but a number. So the ideal client is somebody that just wants to get better. And I know that's cliche, but essentially, if somebody walks into our doors, the ideal client is somebody that values their health, right? And you'll see in our company low back physical therapy and performance, but we don't just treat lower back. We specialize in it, but we treat everything from head to toe. So um as long as somebody values their health and, they're dealing with anything orthopedically, what that means is like anything head to toe, injury or pain, and they have a goal that they want to get to. And that doesn't have to be athletic goal. We've have individuals like, hey, I just want to chase after my kids and they're a bus driver because they sit down all day for driving and they can't chase after their 2-year-old, right? So that's a goal, right? And people love that because they value their health to chase after their kids and they have a goal, right? So I would say that's our ideal clientele. And that value their health is very important because we'll get also individuals that which a big piece of our practice, how we work. We are a private out of network practice. What that means is we don't bill insurance directly. We go directly to our clientele, work with you one-on-one and X out that third party payer just so we don't have interruption in your care and you don't get frustrated. The therapist and the client doesn't get frustrated that, hey, Kyle, we're going to cut you off because we see that you're able to run. But let's say you're running, but you still have knee pain, right? So now we X that person, that third party out, and now I can work for Kyle, right? So this allows us to get you more efficient, better results. So that's where the ideal clientele is someone that values their health. They're not just, trying to get the easy way out. They actually want to invest in their health and invest into not only their health, but solving their problem and their goal that they may want to attain, right? So it's not age specific. Definitely somebody that just values their health. And for us, we want to make sure that we can teach that active individual how to move better, correctly without doing anything invasive like surgery, steroid shots, or even worse, a provider telling them to stop working out, or a family member, or somebody that a friend, hey, you should stop playing pickleball. You should stop running because it's bad for your knees. So we dispel all that. That's our ideal clientele.
I love that. Yeah, and to dive into how we can help people today, right? A lot of the people listening to this right now are business owners, entrepreneurs. We're sitting here on their desk 9 times out of 10. Do you have one piece of advice that we could help or we could be doing throughout the day to help loosen up that lower back, open up the hips, and feel a little bit more comfortable? Because I know, I don't feel as much when I'm sitting here at the desk, right? It feels a little uncomfortable, but I got some weights sitting by me. I'm doing some dumbbell swings. I'm doing some things like that to keep active. What really hurts is after a 9, 10 hour day of paintball, and then I drive 2 hours back home, I am pulling myself out of the car to try to get up out of the car because my hips and my legs are locked up. Do you have any recommendations for workouts or things that we could be doing as entrepreneurs that are sitting at our desk all day to make sure that we stay loose and we're not damaging our hips and our lower body?
Yeah, something practical is just yeah, taking standing breaks. Especially if you're more so at the desk, office. We see a lot of clients that work, office jobs or maybe they work from home, right? So something simple and practical without even us doing any treatment, hands-on treatment, taking standing breaks. So set a timer, 45 minutes. And when that first timer goes off, that's for your first alarm. Okay, I got to get up soon. Then set another timer for 15 to 30 minutes. Once that second timer goes off, stand up, right? Because usually when we get a first alarm, it's like we're not going to stand up and we're like, oh, we'll push it to the side. But definitely 45 minutes. Okay, now that's the trigger. That second timer goes off. All right, now like let me stand up. And you want to do that second timer for 15 to 30 minutes. After that, it's a must that you stand up. If you incorporate that habit, definitely you're saving your hips already just by doing that. Just by doing that. And then also movement is important. So after work or maybe lunch break, just going for a walk or definitely obviously there's some things, I will have to show, that individual. There's a whole bunch we have a YouTube channel, Quality Movement Restoration. We show a lot of quality tips, just how to stretch our hips, you name it, from head to toe. So just going on YouTube, it could be our channel, somebody else's, like, all right, let me hip openers, hip stretches, right? You do that on your lunch break and then obviously go back to work or after work. So those are simple, practical stuff I would say to help the entrepreneur or any individual just working from home.
Awesome. Thank you for that small piece of advice. And yeah, I have a standing desk now. So it's every time I watch it's like, yeah, you need to stand up because we're about getting to the hour and you haven't been up yet. I'm up and go. I need one of those little treadmills underneath me to keep me going. But yeah, that's the next step. For quality movement restoration, you built this business during the COVID year. You've obviously developed, you have a nice office. How big is the business now? Give me a breakdown of what it looks like today.
Yeah, for sure. So currently today we are in a 2,000 square foot office. We have a full gym turf area. We have two squat racks, a treadmill. We do a lot of functional training. What that means is instead of just like doing work on the machines, like we have space to work on functional movement like squats, lunges, stuff like that, right? And then we also have a staff room. We have 3 treatment rooms. We also offer massage therapy. We have massage therapists on staff. So we have a massage room and we also have treatment rooms for the performance PTs like myself to work in. So we have, and we also obviously have like a nice modern bathroom, and we have some dead space in the back that we could all, uh, you know, find ways to utilize that. But that's pretty much like our office. We have 2 performance PTs currently, including myself, and a massage therapist and an office manager. And yeah, that's currently where we are. Our vibe of our practice is gym, spa, and lounge. So when you come in, you just feel very relaxed. We have a controlled, slow pace model because usually when you go to like the healthcare, any healthcare place you go into, either the space just looks like blah, right, and then very fast paced, like and even when you call, hey, what's your date of birth? They don't ask you, hey, what's your name? What do you need help with? So like even when you call us, you feel that over the phone. So yeah, that's our vibe, man. We also have a like an Instagram wall with natural brick, creating that lounge feel. So a lot of our clients give their testimonials on that brick wall. So yeah, man. We also sell merch as well.
No, 'cause listen, definitely came a long way since the car.
That's yeah, for sure, man. For sure. Yes. Yeah.
That's awesome. And where's it going? What's the goal in the next, say, 1 to 3 years? Where are you taking the business?
Yeah, great question, man. Definitely wanna get at least 3 full-time PTs here. So right now we have, outside of myself, 3 full-time PTs. Right now we have 1, which is a blessing. And from there, I wanna work with a nutritionist as well because we're a holistic practice once again. A lot of times when I talk to individuals, a lot of individuals have goals of, "Hey, I wanna lose weight," right? They can't lose weight. I'm not gonna say they can't lose weight. It's difficult to lose weight because they can't move. Like, that they can't move is they have a lot of restrictions, right? But this is where I come in to help those restrictions. But a lot of times it's diet as well. I have my limitations in regards to like providing diet restrictions and stuff like that. So that's where working with a nutritionist would be very beneficial to what we offer. A lot of individuals and that we are working with prior to hiring a massage therapist were interested in massage therapy, and we got a massage therapist, right? So definitely adding that in the next 1 to 3 years would be very beneficial for what we wanna do with serving. And then I would say definitely still brewing and seeing where God takes it, but a lot of clients say, "Man, you can see this being a franchise," you know? I just like for how well this is run and just the difference of it's refreshing to get something different from just the general PT places and a safe place where not only the athlete, active individual, or somebody, like I said, values their health, they just go to and know that provider's working for them.
Love that. Love that. And it just expanding your services so they make sure you fulfill every aspect of what the human needs to be moving better, feeling better, and then expanding the business to get this mindset of more time directly with a doctor all across the US in a franchise model. I'm confident that with your charisma, your attitude, and the will of God, you can push and go that direction. Well, I got two more questions for you. And I want to shift a little bit more to you directly, Dr. Leslie, and talk a little bit about your journey as an entrepreneur. Is there, say, a story or a challenge or a difficulty that you've had to face throughout building this business that you could share with the listeners here as a learning lesson that you had to kind of change your mindset of how to do business or made you a better entrepreneur?
Yeah, for sure. I thought about that question. One thing that comes to mind for sure was last year, Labor Day weekend. I feel like every entrepreneur has that moment where, "Dang, am I gonna go out of business?" It's just natural. I definitely had that moment last year. This is before we bought on our performance PT and before we hired our massage therapist. So it was just me. It was just me and my office manager. When we got this space in 2023, this 2,000 square foot office, we signed the lease. Prior to that, I was like I mentioned, I was in my car in 2020, 2021. I'm sorry, 2022. Got a small office in a gym that worked well, and then we did. I always wanted to expand past myself. I always knew this business, this idea needed to expand past myself. So we got the space in 2023. We had a couple months free rent, so that was good. We did the construction. The town was so slow with permits, but what happened last year when we opened, I did not adjust my service, meaning that I only, like I mentioned, we sell plan of care packages. So usually, with the currently we sell like 6 to 9 plan of care package options. But when I opened up, I only had one offer. So and that offer was a high ticket offer. So when we opened up in February 2024, I was noticing that our sales were not increasing. I was doing the same amount of gross revenue, me being in my small office. So I was like, something is not right. Something's not right. And I had to learn the hard way. I was just thinking like, okay, this space, this expansion is all gonna just like people are gonna just come no matter what I offer. And that was a huge mistake. But what happened in Labor Day, like I was talking to my wife and I said, I don't know. I don't know if I think I gotta get a job. But I'm heavy on my faith and talked to God about it, and He gave me a fresh vision on business. And what I that Labor Day weekend, after talking to my wife, just something hit me to offer massage, offer not only massage, offer massage and PT together, offer different stuff for PT. And instead of having just one offer, that turned into 9, 10 offers. And kid you not, that because Labor Day is the beginning of September, that September, we hit a PR month. So my lesson is don't just offer one offer because when it comes to your clientele base, you have to give people options no matter how good you are. Yeah, especially if you have a higher ticket business and offer, you need to have different options for individuals because now your sales can increase even though you may make less on that individual sale, but now you have more people that are wanting to come work with you, and that expands your not only gross revenue, your impact, referrals. So I would say that was the biggest challenge and lesson I've learned being in business.
Great advice for the business owners, truly. And I only got one more question for you, Dr. Leslie. How do you find your Kaizen? For the listeners out there and yourself, Kaizen is a Japanese business philosophy that means 1% improvement every day, or how you take small steps to a larger goal. What do you do as an individual to make sure you wake up every day motivated, invigorated, and going forward to grow your business, to grow yourself, grow your knowledge base? How do you see the world to find that continuous improvement?
Yeah, definitely 1% every day. I like that. It's so much that the entrepreneur thinks about day to day. Like you can work on your business 24/7, but that's not healthy for me. I definitely have a couple things that's been successful for me. I definitely just one day out the week, I just give a day to God. I don't work. I just focus on my family. So 6 days I could, for sure work on business if I want. But I have something called a brain dump journal. It's been super helpful for me. It's so much things that I want to do in business and think about. And so anything that pops up in my head, I just brain dump it on my phone. It's like a journal I just create on my phone. And every week whatever day it is, whatever comes to my mind, I just write it down. And it just clears my mind and it allows me to be present. I feel like a lot of entrepreneurs aren't present, whether it's, your health, your family, whatever. So that has been a big help for me. I'm very big, obviously, on health. So working out, spending time with my family, and also just making sure that I'm always saying my why in business. I do daily. It used to be daily affirmations, but I say it so well now. I just do it once a week at night, just my affirmations, and that is essentially my go-to on what keeps me going 1% every day.
Man, absolutely love that. Absolutely love that. Dr. Leslie, if someone was in the New York area or somewhere's in the local area, wanted to learn more information about you, how can they find you? How can they get connected with you?
Yeah, so we are located in Lynbrook, New York, and you can find us on our website, quality movement pt.com. We're also on Instagram. We have 10 10K plus followers. We post great content on our Instagram at Quality Movement. We're also on YouTube, post every Tuesday. Quality Tip Tuesday is what we call it. A tip. We have a newsletter that coincides with that on YouTube. Quality Movement Restoration. Like I talked about, you can do that free injury screen to come in, talk to one of our docs, even if you don't move forward with anything that you want. Even if you don't move forward, you have the opportunity to learn more on pretty much like what's happening with you and your health. Personally, also you can follow me at Dr. Villeur. I also have a book that if you're a runner, how to avoid knee pain with running. That's a free ebook. You can also access that on my personal page and the company page, as well as running programs I have curated on my personal page. That is how you get in contact, and that is all.
That is awesome. All the information is going to be found below in the description, guys. Make sure you go check out that Instagram. Make sure you check out their YouTube page. This is valuable information from a doctor who's really focused on helping you move and feel better. Dr. Leslie, thank you so much for your time. We appreciate you. And if you guys have finished this video, make sure you like, comment, and subscribe, and we'll see you on the next Kaizen podcast.